and we are working with the Public Health Department this morning to offer the vaccine. We are doing this. I am agreeing to participate in this because I know how important it is for our community to move forward with the vaccine, and I really want to be a good example. I want to be honest about the fact that I too had concerns. I think that's real for all of us. I still have concerns getting the flu vaccine, but once you've had the flu once and you say, I'm getting the vaccine, I'm never going through that again. And so I think it's important for us to have in this community as much information as possible for all the reasons you already know. And there's not anyone who could say it better than Dr. Sarah Moyer, who is our public health director. So at this point, I'd like to turn it over to her. I probably will ask her some questions, some things that I've asked her privately, because up until this moment, I'm going, well, what about this, Sarah? What about this, Dr. Moyer? What do you think? And so I think it's fair for us to ask questions and have them answered. And I'd like for her to say why she thinks this is important, because you will see people here today that are in the age range that are actually being vaccinated. And then there are some of us, like me, I'm not quite 70 yet. And so the public may want to know why, because I understand that there are some healthcare workers who are saying we still don't have the vaccine. But I think what you'll hear from Dr. Moyer is that there are, even in the healthcare industry, there are a lot of black healthcare workers who are opting not to take the vaccine. And I am concerned always about everybody, but especially about, the health of the black community. And so that's why we're here today. And so with that, I'll turn it over to Dr. Moyer.
Thanks, Sadiqa. All right, so thank you, Sadiqa. I think she said it best. We are here today to show how important the vaccine is and how safe it is and how we are willing to get vaccinated ourselves. So in the last, it's been about 3 weeks, we've rolled out vaccination to our healthcare workers in the 1A category. And looking at the data, we've reached about 70% of our white population that qualifies as healthcare workers, but only 30% of our black population. And so talking with Sadiqa, we decided that we really needed some key influencers to show how safe the vaccine is and how they are willing to get over a lot of their fears and talk to their trusted advisors to get vaccinated themselves to help us spread the word about how life-saving the vaccine is and how it's going to help us get out of the pandemic and kind of turn the corner to a new, better normal. So excited to be here today and to answer any questions anyone has and to really show how safe this vaccine is.
Well,
so what would you like to ask?
I'll tell you what I asked this morning. I said, Dr. Moyer, when I finish with this first dose of the vaccine, can I be around people, or is this going to be in my body and I would end up exposing? I've got 2 kids at home. And so I wanted to know, how safe would it be for me to be around my children? And you answered it.
Yeah, so the vaccine, it's not a live virus. You cannot get coronavirus or COVID from this vaccine. There is a chance that you could have COVID right now and not know it and still get coronavirus 2 days from now, but it won't have anything to do with the vaccine. And hopeful too that once people have the vaccine, even after that first dose, that symptoms are milder if they do catch it, and less hospitalizations, less deaths with it. So an important reminder that we still have to wear masks and stay 6 feet apart, wash our hands, but the vaccine is one more tool to keep us safe and keep us out of the hospital and healthy and here for tomorrow.
So if I happen to have COVID now and I get the vaccine today, you're saying the vaccine is not going to make it worse?
It won't make your symptoms worse, yeah. And my hope is, much like other vaccines maybe in the future, will show that it makes it less bad.
All right, okay. Well, do you all have any questions for Dr. Moyer or me?
I have one for you, Sadiqa. What was the importance, you talked about why you wanted to be here, but the importance of inviting these community members as well. Can you talk a little bit more about that?
Absolutely. I think it is so important for people in our city and across the country to see that there are people we have ministers here, we have grandmas here, we have the black community is represented, and I wanted people to make sure that they understood that all of us are saying we trust this enough to move forward, and we think, we are not medical professionals, but we're trusting the medical professionals. So the Urban League is not giving medical advice, I'm not giving medical advice, but we trust enough that we're doing the right thing, and we hope that as people see us doing it, they will be influenced to do what is right for them. based on what their healthcare professional says. Media questions?
I have something, Dr. Moore. I know we're talking about the phases as far as rolling out the vaccine, and you all spoke to the kind of disparity as far as the white population taking the vaccine versus the black population taking the vaccine. My question is, beyond healthcare workers, do you think that's something we would see in the black community as a whole versus other communities, or once the other phases begin to roll out, and is that part of why you all are doing this today?
Yeah, that's exactly why we're here today, is to try to not have that happen. We're hoping that getting key people and showing some trust in the vaccine, that we won't have that going forward. Our goal is that we know the educators are starting to get vaccinated this week. My hope is that 100% of our black educators choose to say yes and get vaccinated, or at least be the same percentage as our white educators. And so hoping that today helps with that, and then helps with the others in 1A that maybe said no at first, that they sign up to get vaccinated. So for the general population, if you're in the 1A category, healthcare worker, go to our website. There's a link on how you can get vaccinated through Norton. You can sign up there. If you're in the 1B, spots are full right now. Do not show up at the Urban League tomorrow or at the health department later today. Spots are all full. We have a wait list. There's about 53,000 people as of yesterday on it. And so we're expecting to take at least 5 weeks to get through that. But please add your name to it. If you do not have internet access to fill out that form, there's the phone number, and I will give it to you guys to call. I don't have it memorized, but you can call. We can help you fill out that form. And then I think there's other ways as well, too, that Sadiqua might have some spots that they have reserved through Norton to get vaccinated, too. So thank you for that.
Yep, we've shared the link. I'm not going to be able to do a bunch of questions. We're going to do media because we've got to get started on this, but I'll take just a couple more if you all don't mind.
I'll be real quick.
You're never real quick, Luther. I've never seen that, ever. But go ahead, let's
Real
try.
quick.
Okay.
The question is, seniors that live in senior living apartment buildings that do not drive. Number one, the testing for that. Number two, how are we going to vaccinate those? And, you know, it is a large, predominant number of residents in West Louisville that are seniors,
Yes.
that do not drive, that
Yes.
do not get out. I'm a resident of 23 and
Let me answer your
I'm
question.
done.
We've already made arrangements for your building. We're working on others. It is complicated, and you know that, but we are trying very hard to ensure that the public health department knows where those folks are. As for your space, though, we are moving forward with that, but we do have to work on that. It is an issue. We've done transportation in many cases. Even when we had COVID testing, we had to arrange for transportation, and that's tricky because there are people who don't want to necessarily drive a van with people who, you know, are wearing masks or whatever.
Right.
So this pandemic has complicated all of our lives, but we're doing everything we've always done to make sure that we take care of the people who need to be taken care of. So we're working with public health, and honestly, Norton has been an amazing partner. It's interesting to me that building a sports and learning center has had a greater impact. Our relationship with Norton is significant in all of this, and I can't say enough about what they have been willing to do, so we'll get it done. They'll get it done. You know, we'll make sure they get there. Yes, sir.
I had a question just about the low vaccination rates within the black community. I've heard some voices on the national level, but I wanted to hear from you. What are some things that you're hearing? Or you said you had some concern yourself, too. So, you know, what are some things you're hearing, and what are some things that you were thinking, factors that might play into that low rate?
The trust of government has never been less than it is right now. Anything related to government, and that is national and quite frankly, locally, right? So what we do still have, and it's interesting though, Dr. Moyer seems to have preserved her relationship with the community, and there still is trust. We need politicians to get out of the way and let healthcare officials lead on this. We are in a pandemic. This is a serious time. This is not, we don't care about what these elected officials. This is about the people who know the science. And I'm nervous because black people have no reason to trust the government. We are the ones who have been experimented on. We have always been disposable in this country. So I still feel that. I was raised with people who felt that. So today I am overcoming fear to trust the science. That's the bottom line. Yes, sir. Dr. Malone.
I don't have a question, Sadiqua, but my comment, and it relates to the question just raised. I am here today for one reason and one reason only. I came today to be an example.
Yes.
And to step out front, to take the shot, to encourage African American people to take the vaccine.
Excellent.
That's why I'm here. I'm
Excellent.
here to be an example.
Excellent.
All right.
I am here with prayer and the health department director that I hired. So I don't think she tried to kill me, right? Okay, all right. Okay, with that, I think we'll start. I'll go first, and then Rhonda Mathis will go next, and we'll go from there, okay?
I want a superhero Band-Aid.
Is it gonna hurt?
So what they got?
Needle stick, you've had it before.
Small pinch.
It's not
Put it
down,
down, relax it all the way, let it dangle, dangle all the way down, there you go.
All right.
Great, thank you.